Hey guys, I'm Sarah,
And I'm Amber.
and we're going to teach you about STIs and AIDS.
But first, we went around campus and asked students what they knew.
How can someone get HIV?
I don't know actually, but I know you should get tested. It has free testing for HIV. Get it checked. It's free.
How many STIs can you name?
Chlamydia, HIV, human papillomavirus virus. I don't know, it's probably something. Chlamydia, gonorrhea, and AIDS.
How can you prevent the transfer of STIs?
Condoms or abstinence.
What do you know about HIV?
It's the first step to getting AIDS, and it is through blood.
What is the most common STI for college students?
Chlamydia.
How many STIs can you name?
Chlamydia, warts, and crabs.
How many STDs can you name?
Chlamydia, gonorrhea. That's it.
How can you prevent the transfer of STIs?
Abstinence.
Condoms.
Condoms.
How many STDs can you name?
AIDS, hepatitis A, B, and C. Wait, how many was that? That was 4. Is herpes still an STD? No one's calling me. I'm gonna say herpes, chlamydia, syphilis, gonorrhea. Yo, I was gonna get that. 8.
Chlamydia, gonorrhea, and syphilis can all be treated by antibiotics because they are a bacterial infection.
And first, we're going to talk about chlamydia. So, chlamydia is a bacterial infection. Most people don't develop symptoms but can still get infected through sex. And some of the symptoms are a burning sensation when urinating, unusual discharge, pain and swelling in the testicles, bleeding, and rectal pain.
Gonorrhea is a bacterial infection, also referred to as a CLAP. If left untreated, it could cause infertility. Around 75 million new cases of gonorrhea are diagnosed each year, and it can cause other infections such as pelvic inflammatory disease. The symptoms include green or yellow discharge, pain in the testicles, painful urination, swelling in the lymph nodes, and abdominal pain.
And then syphilis is also a bacterial infection. It's usually spread by sexual contact that starts as a painless sore. And the symptoms for this one, the first stage is painless sores on the genitals, rectum, or mouth. The second stage is after the sore heals, it is considered a rash. And the third stage is no symptoms until the final stage, which will not show up for years. This stage can cause damage to the brain, nerves, eyes, and the heart.
On the other hand, genital warts and genital herpes are a viral infection, and antibiotics and other medications can help, but it can't be cured.
So genital warts, they start as small bumps on the genitals caused by a common sexually transmitted infection, and the symptoms are a gray-colored growth in the genital areas, warts, itchiness, and a burning sensation on the skin.
Genital herpes are an infection marked by genital pain and sores. The symptoms include painful blisters that can open and ooze, blisters appearing in the mouth, on lips, face, and anywhere else. Infected sites often start to itch, blisters become open, and the lymph glands become swollen. Scabies and pubic lice are also treated by topical medications.
So pubic lice is also known as crabs. It's small parasites attached to the skin or found in a person's pubic hair, eyebrows, chest hair, armpits, beards, or mustaches. And the symptoms are itching, white eggs in clumps, dark or blue spots on the skin, feverish, run down, and irritable.
Scabies are a contagious, itchy skin condition caused by tiny burrowing mites, commonly found between the fingers, fold of skin on breast, genitals, neck, or face. Symptoms include itching, rash, sores caused by scratching, and raised lines in the skin.
So what is HIV?
Isn't it like a... Shoot, I don't know. Yeah, I know what it is, so like I don't know how to explain
It's
it.
okay. Do you know what AIDS is?
Yes.
And do you know how you can get HIV or AIDS?
Are they sexually transmitted?
Do you know what HIV is, and do you know how someone can get it?
I don't know what HIV stands for, but I know you can get it through sexual contact.
Do you know what AIDS is?
I don't know what AIDS stands for, but I know if you have HIV, it can lead to AIDS, and there's no cure for it.
What is HIV?
It's a sexually transmitted disease.
Do you know what AIDS is?
It's to do with your bloodstream, and yeah, that's it.
And then do you know how you can get HIV or AIDS?
Through like saliva or like passing blood, like sharing, like your blood touching someone else, or sexually.
Do you know what AIDS is?
It's a disease of some sort.
Do you know what HIV is?
It like corresponds with AIDS. Like if you get HIV, don't you get AIDS? Like isn't it the same thing?
Similar. And do you know how you can get HIV or AIDS?
Through like saliva or like actually like DNA passing of some sort.
So, AIDS stands for Acquired Immune Deficiency Syndrome. Acquired means you can get infected. Immune deficiency is the weakness in the body system that fights the disease, and syndrome is the health problems that make up the disease.
AIDS is caused by the HIV virus, sex, and sharing needles, and there is no safe cure.
So some of the common myths on how you acquire HIV. So shaking hands, hugging, kissing, and sneezing are some of the common myths. So you actually can't get HIV through that.
Ways to avoid are condoms. If blood and body fluids come into contact, immediately wash off. And education. You can always be educated on stuff like that.
So the early symptoms of HIV are fever, chills, enlarged glands, weakness, weight loss, joint pain, and sore throat.
Late symptoms are blurred vision, dry cough, shortness of breath, white spots on the tongue or mouth, and permanent tiredness.
Go.
So we were wondering what kind of testing you guys offered here for students that are sexually active.
We do every kind of STI testing you can imagine here. So usually what we'll do is we'll kind of go down the list of the different sexually transmitted diseases, and we'll do a complete sexual history and then make recommendations about what things we would recommend that they be tested for. The most common one that we do is chlamydia and gonorrhea testing, because it's simple, it's easy, it's a urine test. So that's the most popular one. Also because chlamydia, like 75% of the women don't have symptoms, 50% of the men don't. So that's one that you would want to screen for, because the majority of the folks are not symptomatic. So that's probably our most popular one. I'd say a lot of the students come in thinking that there's one test for everything, and there isn't. So as I mentioned, there's the urine test for chlamydia and gonorrhea, and then blood tests. We can then do HIV testing with blood testing. We can do syphilis testing, Hep B, Hep C, all through a blood work. The one thing we can't do is test for HPV, human papillomavirus, or genital warts. For males, there is no test for that. For women, what's recommended is once they turn 21, that they get a pap test, because the pap test will pick up on abnormal cells on the cervix. And then we can do type-specific testing. So then we can test for HPV 16, 18, or whatever, if the pap test comes back abnormal. There's a lot of controversy about whether you should screen for or test for herpes, which is possibly a blood test, but even the Centers for Disease Control doesn't recommend doing blood testing for herpes. Yeah.
Interesting.
Yeah, so have we done it? We've done it, but I don't like doing it at all because there's two reasons. You know, everybody remembers HSV1, herpes simplex virus 1, as being cold sores on their mouth, cold sores, herpes, and then HSV2 being genital herpes. When in fact now, and it's been about 5 years, now we're seeing more HSV1 in the genital region. So if you do a blood test and it comes back positive for HSV1, it doesn't tell you where it is in the body. And you're somebody who could have a past history of cold sores. You and, 80 million Americans can have that. And so it doesn't really distinguish. And even the blood testing themselves doesn't do a really good job distinguishing between HSV1 and HSV2 either. So there is some cross reactivity between the two tests. So hence we don't recommend it. But if you really want to insist on it, go right ahead. So, but yeah, so we do is that a lot of testing. If there's one thing we know on campus is we know a lot about sexually transmitted illnesses here. Because we treat a lot. We see a lot, we treat a lot.
And so you guys take walk-ins, you don't need an appointment, or?
Correct. The majority of our business is walk-in for illnesses, acute episodic illnesses. Women can make an appointment for a women's clinic, so if they want to get their pap test, they can make an appointment. Or we also recommend that women make an appointment for birth control, because even going on birth control pills, it takes about 45 minutes to do a complete history, and then review what some of the recommendations are, the different birth control pill options that there are, and then trying to find one that works for the student.
Okay.